An oncology patient navigator can help a patient when they're diagnosed with cancer emotionally through several ways, depending on what may be best for the patient. For example, some patients may enjoy reading, so we have the Lady Lion Resource Center that has books about how to support your loved one emotionally, how to support yourself emotionally as you're going through this diagnosis. We also have face-to-face visits we can make with our patients. For example, when patients are receiving chemo or radiation, we can visit with them and offer them support at that time. And thirdly, we can offer phone support for these patients. We call them and talk to them and see what needs they may have and just offer support over the phone that way as well. There are lots of different organizations that can help cancer patients emotionally. We have national organizations that we work with that can provide phone support and support groups online even with our patients. And locally here, we are very blessed to have many organizations that help our patients. Oftentimes people have gone through cancer themselves and they get involved in our local organizations and give back to our patients either through donating gift cards or providing care in different ways to our patients through these organizations. So there's lots of emotional support available to our patients locally and nationally. There's lots of different supports that we can offer to patients when they're diagnosed. It's often a shock to them, and so there are different resources that we can provide to them therapeutically. They can choose to do a support group. They can choose to talk to people one-on-one, or they can choose even to make a phone call to a national organization and receive support through a licensed counselor that way. We have a list of local counselors that we can refer patients to as well if they choose to get therapy one-on-one here locally. Oftentimes when a patient's diagnosed with cancer, there are various effects that the treatment can have on them. One of these is hair loss, and for women this can be a particularly difficult issue. So as oncology patient navigators, there are various things we can recommend to them. One would be a wig or a scarf, and it's up to the patient what they choose to do. And there are various options for this. One is we have a national organization we work with that provide wigs at no charge to a patient. The other could be local salons working with patients who choose to go meet with them. And the third is individual companies who work with patients one-on-one to make sure that they're comfortable in the wig or scarf that they choose. There's no fee to utilize an oncology patient navigator. Our job as oncology patient navigators is to remove barriers to our patients' care. And those barriers may not just be transportation or financial, they may be emotional. And so Mount Nittany sees the value in making our patients healthier, not just with treatments and with doctors and nurses, but also emotionally. So that's why there's value in what we do. If a patient's diagnosed with cancer and they need to reach out to oncology patient navigation, there are several ways that we can be contacted. The first is a physician referral. The second would be if the patient would like to reach out to us personally, they can pick up the phone and call us or email us. And the third is if you are a friend who has somebody you love or know who's been diagnosed with cancer, you yourself can pick up the phone and call patient navigation, and we'd be glad to provide you resources to help your friend as well. I'm passionate about the work that I do, and one of the things I think it's important for all cancer patients to understand is that there's so much they are going through as they get this diagnosis and with their treatment, that oncology patient navigation wants to be there to support you financially and emotionally, help you find a ride to treatment if you can't. And I often tell caregivers when I'm working with a patient and their family that your job is to take care of the patient, and our job is to help remove these barriers so that you can focus on getting them healthier.